walk into the patient's room for hand hygiene, put on gloves, identify the patient, ask them their name and date of birth.
Ariana Irving, December 2nd, 98.
And check their wristband, make sure it matches. If it was not just us in the room, I'd provide privacy. Comfort, make sure everything is put together and ready. And orientate the person to place, time, and situation. Do you know the date today?
Today is September 20th, 2020.
Do you know why you're here?
For a checkup?
Yep. Head-to-toe assessment. Then I would have them ambulate to get their weight done and their height. Check their, see if they're alert, know what's going on. For posture, this patient looks pretty good, so we will move on. Check their speech, make sure they're speaking correctly, hearing, make sure they can hear me. And then we would do a full set of vitals before we continue. So now we would do the head and face. Palpitate here for any sinus issues. Feel me shaking?
Mm-hmm.
Check their head. TMJ, open your mouth. No issues there. And I would check cranial nerves 5, so I'll have you close your eyes for me. Tell me where I'm touching.
Right side. Cheek.
Okay, and then cranial nerve 7, have you smile, frown, check for symmetry. Perfect. And then we would do Perla. I get out my pen light. Check the pupils. First I would measure them. We're at a nice 4. Put this in your eyes. Changes to a 3. 4 to 3 looks good. Have you follow my pen? The shakiness again. Perfect. Check your ears. Oral mucosa. Looks good. Check both the ears. Alrighty. Tell me if you can hear this.
Yes.
Alrighty. Do you wear contacts, glasses, any vision changes lately?
Nope.
Alrighty. Onto the nose. Check. Alrighty. This is my alcohol swab. You don't know that. What does that smell like?
An alcohol swab.
Perfect. Open your mouth. Check your throat. Looks normal. Alrighty. Any issues with swallowing?
Mm-mm.
Eating correctly?
Yes.
Can you check your shoulders, shrug resistance, check their trachea, make sure it's midline. Pulses on each side, but not at the same time. Make sure they're even. And I would listen for a bruit. We don't want to hear a whooshing sound. Listen on both sides. Nothing. Perfect. Alrighty. Jugular vein distension. I'm gonna have you look to the right and the left for me. With your neck, with your head. There we go. Alrighty, other way. Looks good. Alrighty. Now for the back. Can you turn that way for me? Thank you. I'd expose their back, check the skin, check their spine, make sure it's symmetrical. Check the kidneys for CVA tenderness, any tenderness back here. Alrighty. Check tactile fremitus. Up here, have you seen 99 for me?
99.
And down here.
99.
Alrighty, and then have you take a big deep breath for me. Perfect. And while we're here, I will also take the lung sounds in the intercostal spaces. Will you take a deep breath for me? And I check back here in all the spaces. Alrighty. Then I would also tape the lungs in the front as well. You can go ahead and face forward for me. And all the spaces, make sure it's not over bone or breast tissue so we can get nice clear sounds everywhere on both sides. Make sure they're bilateral. Sounds good. Now we are onto the heart. So I do a visual inspection, palpitate for the PMI, which is in the 5th intercostal space down here. Then I would listen in the aortic. For the lub dub sounds S1 and S2. Aortic, pulmonic, tricuspid, Erb's point, liver necklace here, and mitral. Alrighty. Next, I would have the patient lay down and assess their abdomen with light palpitation. Any tenderness. Ask them about their diet, if they've been eating well. Then I would also take for the bowel sounds. Alright, do a visual inspection, and then I would check pulses, make sure they're even. Radial and ulnar, brachial. And down to the feet. I don't know if they can see your feet. Okay. Popliteal, posterior tibial, alrighty. Then we could check muscle strength. Lift your legs for me. Have them push against my arms here. I'd rate this on a scale of 1 to 5. Pulses on 1 to 4. Have them push up against my arms. Same with the arms. And then I would check for sensation of the heel here. Make sure they can feel that. Tickles. And then I check for edema. Oh, I forgot to check for this. Aortic bruit here. Don't want to hear a whooshing sound. Alright, then we're finished. I'd ask the patient if they have any concerns, questions.
No, thank you.
Alrighty, and we're finished.